Hello and welcome. Today we're diving deep into a critical topic in kidney health: post-renal acute kidney injury, or post-renal AKI. We'll explore what causes it, how it affects your body, how it's diagnosed and treated, and what you can do to prevent it. So, let's get started. Post-renal AKI is all about obstructions. Think of your urinary system as a plumbing system. The kidneys filter waste and produce urine, which then flows through the ureters, into the bladder, and finally out through the urethra. Post-renal AKI occurs when there's a blockage somewhere along this pathway, preventing urine from flowing freely. Common culprits include kidney stones, tumors especially in the bladder, prostate, or cervix, blood clots, scarring or strictures of the ureters or urethra, and in men, an enlarged prostate gland, known as benign prostatic hyperplasia or BPH. Certain medications can also contribute by causing crystal formation in the urine that leads to obstruction. Less common causes include congenital abnormalities of the urinary tract. Now, let's understand how this blockage affects your kidneys. When urine can't drain properly, it backs up into the kidneys. This back pressure, known as hydronephrosis, causes the kidney to swell. Prolonged back pressure then reduces the glomerular filtration rate, or GFR, which is the rate at which the kidneys filter waste from the blood. The reduced GFR leads to a buildup of waste products, like creatinine and urea, in the blood, ultimately resulting in kidney injury. If the obstruction is prolonged or severe, it can cause permanent kidney damage. The exact prevalence of post-renal AKI can be challenging to pinpoint, as it often depends on the specific population and the availability of diagnostic resources. However, it's estimated to account for approximately 10% of all cases of acute kidney injury. The incidence tends to be higher in older men due to the increased likelihood of prostate issues, but it can occur in people of any age or sex. Kidney stones and pelvic cancers are also significant contributing factors, and these affect a wider range of individuals. The signs and symptoms of post-renal AKI can vary depending on the location and severity of the obstruction, as well as how quickly the problem develops. Some people may experience no symptoms at all in the early stages, while others might have significant discomfort. Common symptoms include decreased urine output or anuria, complete absence of urine, difficulty urinating, a feeling of incomplete bladder emptying, frequent urination, urgency to urinate, pain in the flank or lower abdomen, blood in the urine, hematuria, and swelling in the legs, ankles, or feet, edema due to fluid retention. If the kidney injury progresses, you may also experience nausea, vomiting, fatigue, confusion, and even seizures in severe cases. Diagnosing post-renal AKI involves a combination of physical examination, blood tests, urine tests, and imaging studies. A physical exam may reveal tenderness in the flank area. Blood tests, specifically a serum creatinine and blood urea nitrogen or BN, are essential to assess kidney function. An elevated creatinine and BN level are key indicators of kidney injury. Urine analysis can detect blood infection or crystals in the urine. Ultrasound is often the first-line imaging study, as it's non-invasive and can effectively visualize hydronephrosis. If the ultrasound is inconclusive or more detailed imaging is needed, a CT scan or MRI may be performed to identify the location and cause of the obstruction. In some cases, a urologist may perform a cystoscopy, which involves inserting a thin, flexible tube with a camera into the urethra to visualize the bladder and urethra directly. Post-renal AKI can be further categorized based on the location and nature of the obstruction. It can be unilateral, affecting only one kidney, or bilateral, affecting both. Bilateral obstruction is more likely to cause significant kidney injury. Obstructions can also be partial or complete. Complete obstructions obviously pose a greater immediate threat to kidney function. In addition, obstructions can be acute, developing rapidly, or chronic, developing gradually over time. The primary goal of treatment is to relieve the obstruction and restore urine flow. The specific approach depends on the cause and location of the blockage. For kidney stones, options include pain management, medications to help dissolve the stones, shockwave lithotripsy to break up the stones, or surgical removal. For prostate enlargement, medications to relax the prostate or shrink it may be used. In more severe cases, surgery to remove part of the prostate may be necessary. Tumors obstructing the urinary tract often require surgery, radiation therapy, or chemotherapy. In many cases, a temporary drainage procedure such as a catheter insertion, nephrostomy tube, or ureteral stent is necessary to immediately relieve the pressure on the kidneys. A catheter is inserted into the bladder through the urethra. A nephrostomy tube is a catheter inserted directly into the kidney through the back, while a ureteral stent is a small tube placed in the ureter to keep it open. It's also important to address any underlying medical conditions and manage fluid balance and electrolyte abnormalities. Preventing post-renal AKI involves addressing the risk factors. Staying adequately hydrated can help prevent kidney stones. Regular checkups, especially for men over 50, can help detect prostate problems early. Promptly treating urinary tract infections can prevent scarring and strictures. And being aware of medications that can cause crystal formation and discussing alternatives with your doctor is also important. The prognosis for post-renal AKI depends on the duration and severity of the obstruction, the underlying cause, and the overall health of the individual. With prompt diagnosis and treatment, most people recover fully. However, prolonged or severe obstruction can lead to chronic kidney disease and even end-stage renal failure, requiring dialysis or kidney transplantation. Current research focuses on developing more effective and less invasive methods for removing obstructions, as well as strategies to prevent the recurrence of kidney stones and other causes of urinary tract blockages. Novel imaging techniques and targeted drug therapies are also being explored to improve outcomes for patients with post-renal AKI. Thank you for joining us today. We hope this overview of post-renal AKI has been informative. If you have any concerns about your kidney health, please consult with your doctor.